Bill A.273 proposes that physicians should be required to prescribe non-opioid treatments for neuromusculoskeletal conditions. These treatments include PT, OT, massage therapy, chiropractic care, acupuncture, exercise, and other non-opioid alternatives. The bill is a federal piece of legislation that has currently passed the Senate and is sitting at the third reading in the Assembly. It's currently co-sponsored by Democrats and no Republicans in the Assembly. However, they received a lot of Republican support in the Senate. The policy's goal is to decrease the number of opioid-related overdoses and limit easy access to the addictive substances from healthcare providers. This bill is important because deaths related to opioid overdose has skyrocketed, especially over the past 10 years. There were 21,000 deaths in 2010 related to opioid overdoses, and it's jumped from that 21,000 to almost 50,000 in the span of 9 years. It continues to rise each successive year, so this number continues to increase. Several states have adopted legislation limiting access to the pharmaceuticals. However, New York is not one of the ones who've been involved. New York State allows a 7-day initial supply of opioid prescriptions, but 1 week does allow enough time for a patient to become addicted to these substances, and they are able to go and receive a refill after that initial week if needed. Patient populations that do not fall under the mandates of this bill would be individuals who are in hospice, those who have a diagnosis of cancer, patients coming out post-surgery, and also in the case of a medical emergency. And this is because patients in these categories often experience more pain and have been found to respond poorly to alternative treatment options. There are a few key players in the passage of this bill. The main ones will be the legislators in the Senate and the Assembly. Some of the informal players will be those involved who do have more of a say in the bill. This would include voters, physicians, OTs, chiropractors, PTs, massage therapists, patients, and families. Some of the obstacles that are currently holding up the bill in the Assembly are a lack of political priority and the controversial nature of pain management techniques. So the lack of political priority, currently their main concerns in policy for healthcare surround insurance, abortion, and health privacy. So it's kind of distracting the attention away from the opioid epidemic. And also, in many cases, strong pharmaceuticals are the only options that seem to have any effect on individuals who are experiencing chronic, intense pain. So many people just want the medications instead of coming to receive an alternative treatment. Lastly, the passage of this legislation is relying on professional adoption of concepts it promises. In other words, the legislators are hoping that physicians actually do consider alternative treatment options, but there's no way to actually monitor or enforce the policy. The passage of this bill would have an impact on the profession of occupational therapy because OTs may potentially be treating less individuals with addiction. If the policy were to die in the Assembly, OTs would resume their battle with readmittance rates of patients who simply can't overcome the cycle of addiction. Other considerations regarding the impact on OT could include insurance caps. If OTs are to effectively treat chronic or acute pain with no medication, insurance companies will need to be willing to cover both expensive treatment options as well as the extended frequencies and number of appointments that patients will require. It may even be suggested that OTs can receive special education or CEUs for attending lectures on pain management strategies and techniques. My recent involvement with Bill A.273 involved meeting with my local Assemblywoman, Pamela Hunter. Hunter was very open and knowledgeable, and she admitted no prior involvement with Bill A.273. Rather, she had extensive involvement with insurance policy, so this is something she wasn't very familiar with. But the bill was brought to her attention, and she stated that she was going to research its history a little more and plans to vote for the passage of the bill in the future.